we're gonna do the cranial nerve assessment to make sure that there's no injury that's more severe than a concussion. So if any of these assessment is positive, you need to refer to the emergency. So the first cranial nerve is the olfactory nerve, so it's tests the sense of smell. So you can take a little alcohol pad, pass it under the nose of your athlete and ask, can you smell this? You know what it is? Mm-hmm. Okay, good. And then the optic nerve is the one responsible for vision, so you can ask them to read
alcohol prep pad.
There you go, fine. And then the next one is oculomotor. So this one is responsible for the pupil reaction to light and also eye movement. So what I'm gonna do is take my pen light and just put it in her eye and look if that eye reacts to the light. I'm gonna do it again, but then I'm gonna look at the other eye because they should both react to the same stimulus. And then I look at the other side, it reacts, that's fine. Now I'm gonna do the same thing on the other eye. It's fine, that's fine. And then I'm gonna test the trochlear nerve that's responsible for eye movement. So what I'm gonna ask her to do is follow my pen light without moving your head. So just follow my pen light. So I go from side to side, which is also the abducens nerve, and up and down and diagonal. Usually I can also assess if they're dizzy at that point because that tells me there might be another issue in the brain, so I want to make sure. So that's the trochlear nerve and the abducens. Trigeminal is a sensation of the forehead, so you ask her one side, you feel this? Mm-hmm. You feel the same thing on the other side. Mm-hmm. Facial nerve is the rest of the face, so you can do, you feel the same thing on both sides, the same thing on your chin. Mm-hmm. There we go. Vestibulocochlear nerve is responsible for hearing, so you can ask her to close your eyes, and then you can snap on one side and ask her what side was that on. That's fine. Moving on to the next one. Glossopharyngeal nerve and the vagus nerve are both responsible for swallowing, so you can ask her, can you swallow? Yep. There we go. And now accessory nerve is responsible for innervation of the trap muscle that does elevation of the shoulder. So I'm going to ask you, can you push against me? Good. Perfect. And the last nerve is the nerve hypoglossal that innervates the tongue. So I'm going to ask you to poke your tongue out. Good. So that's the cranial nerve assessment.